Feedback in general practice can sometimes be a really challenging thing. And in this episode, myself and Andy are going to talk about how you can get better feedback for your practice team with your populations. This has been spurred by one of our EGP learners asking us a specific question, and we're going to answer that for you right now. This may help with your capacity improvement plans or other plans you may have in practice. So let's crack on as we tech enhance your primary care and learning. Hey Andy, how are we doing there today?
Yeah, I'm good over here, Gandhi. I'm really excited to be doing this episode in response to a viewer question and hoping that we can maybe do this more in the future if other viewers have other questions or dilemmas that they want us to pick apart. But in particular, this morning, the theme is feedback. So we had an email from Victoria, one of our EGP learners out there. She said, good evening, Andy and Gandhi, and hope you're doing well. My name is, and I am a GP partner. I came across your details when I watched your YouTube video on the new contract. Thank you for all the information. It has been really helpful, and I was kicking myself for not finding out about your YouTube channel sooner. She's saying all the right things here. I'm interested
if you
in
haven't
finding...
heard about us as well, make sure you subscribe as well, so you do get all this stuff and things, and ring that little bell so you can get all of it straight away as well.
Yeah, absolutely, Gandhi. Yeah. So Victoria's saying all the right things to promoters here. She says, I am interested in finding out more about your in-house patient surveys. I am looking to do something similar in my practice, and I had a few meetings with SurveyMonkey, but their quotes are expensive. Could you please advise on how you do these in-house surveys? You suggested that you send texts and also do the friends and family tests via text messaging. I would be keen to understand your process and to see if it is something that we could replicate in my practice. Thank you, and I look forward to hearing from you. So that's great. So yeah, so this made us think, didn't it, Gandhi, about feedback. And we thought we'd do an episode giving some general thoughts about feedback and how to use it productively and well in general practice, and then answer Victoria's question specifically and talk about probably how we both do friends and family surveys. So how does that sound, Gandhi?
Sounds like a plan. Shall we get cracking?
Yeah, let's go for it. So yeah, so the first thing that came to mind when we were thinking about feedback is it's important to have the right mindset around feedback because feedback, I think, coming up through training, it can often feel like a chore. It can often feel like something that's there to judge you, to punish you potentially, and feedback can be challenging for the image we have, of ourselves or of our practice, and that can lead to sometimes quite defensive responses. I think people can say things like, oh, the feedback is flawed, there's too few responses, there's selection bias in who's being asked, or people say things like, but my population's deprived, so these results don't generalize, or at the other end of the spectrum, my population's too entitled, they have different needs, that's why it's different. I mean, do you hear things like that, Gandhi, out there when you're doing feedback with your PCN practices, I guess, or otherwise?
Definitely. I mean, sometimes that can be related to the way that you try and capture the feedback. So there's always that question, which we will cover later on in this episode about capturing the right type of feedback. But like you say, it's understanding what type of feedback you're trying to gain, and also, is this transferable to the rest of your population? And actually, the reality is it won't always be, but that's not the issue. The issue is getting feedback in the first place and understanding how to manage the feedback that you then get, which we'll be talking about right about now.
Yeah. So first say, so a lot of those criticisms of feedback, like, they are true, right? People aren't wrong when they say those things. But then also what's true is that often, the same methodologies are being applied across different practices. Patients are being asked the same question in the same way, with GP survey. So whilst we can be critical of the feedback, sometimes there is something there. But I would say, actually, having the right mindset around feedback. So yes, be critical, but also be open to the feedback, be open to change. And actually, if you respond in an open and honest way, and you're happy to change if you need to, then, feedback should be something that's actually quite safe. So I think we just need to be secure in our mindset. So hopefully people's mindsets are adjusted to the right place to have a productive rest of this episode. And then I guess once our attitudes are in the right place and our mindset's right, we just thought we'd look at it through a few different lenses just to help us think about the different aspects of feedback, really, I guess. But Gandhi, what do you say? What is feedback to you? I sometimes think of the feedback loop, but just in very general terms, what what is feedback?
I think feedback's any commentary or change in the way that you're trying to do anything within, obviously in this lens we're talking about general practice, but obviously in what you're trying to do. I mean, I use feedback loads in my teaching that I do. So often I teach in BTSs and other kind of situations, and every session I will deliver, I will ask for feedback. And the reason I do that is so I can understand what it is people have obtained from what I've delivered and how can I improve that moving forward. And I think in general practice, within that same lens, it can help you understand what the actual needs and wants of the population you're trying to look after, or the person you're trying to look after. And that can then hopefully help you to temper and adjust to what they're trying to, what effectively you do need and stuff. And that therefore means that you get a better service for your patients. And more importantly, you're not then doing things that you don't need to do as well, which is often a problem in general practice. We do so much that actually, what are the priorities for your area?
Yeah, absolutely. And I guess I see feedback in terms of as part of a cycle. People talk about the feedback cycle, I guess, and
Yeah.
for me, I think it has to be part of an improvement process. That's
Mhm.
going somewhere, or that is at least open to change. There's no point asking for feedback if it's not going to change your mind, if you just want to validate some pre-existing conclusion that you've got. I think it has to be part of an improvement cycle, essentially. And Candy, I really respect your attitude towards feedback, I have to say, because I've been in many meetings that you have chaired. So this isn't
Mhm.
teaching, this is just chairing a meeting. And often you will say, here's a condensed, bit.ly link.
Yeah.
Please click on this. I'll put it in the chat, and give me some feedback about how I've chaired this meeting and how we can improve this meeting. And I think that's like just an example of a really, really healthy attitude towards feedback and improvement. And I commend you on that, Candy.
Thank you. And some of those tips are the ones we'll be sharing in this episode of how you can hopefully get better feedback as well. That's always
Yeah, so we
important.
talk about some of the nuts and bolts towards the end as we do
Yeah.
answer Victoria's question and provide some genuine advice. So yeah, actually, types of feedback. So this is another thing just to think about, really. So I mean, when I thought about this, Gany, I was sort of thinking of categorizing in terms of actually at a very high level. There's quantitative feedback. So sometimes
Mhm.
we can collect data about what's happening. Often that is a more objective process and provides a certain sort of understanding and feedback about what is happening and how we're working towards a goal, potentially. And then there is qualitative feedback. And often we ask for both together. I
Mhm.
think they're both useful in different ways, I guess. I mean, how do you think about the different uses of qualitative, um, in terms of patient stories, narrative, free text
Mhm.
feedback versus the quantitative numbers? How do you use each of those, Gandhi?
I mean, they have different uses, don't they? So if you're looking at quantitative, so that's data, that's figures, that's stuff that you can measure, that you can then adjust and then see a variance when you can collect, various episodes of feedback, isn't it? So that could be, how have you rated your access 1 to 10, 10 being amazing, 1 being absolutely atrocious. And over a period of time, that will give you a benchmark and a metric to track and stuff. So then you've got that information. In comparison, you may have, for example, a compliments book where people can give qualitative feedback in terms of their experience and stuff. Now, whilst that's harder to put into a data algorithm and that kind of stuff, actually that qualitative feedback can actually be sometimes more impactful, particularly for those involved in that patient's journey. So if they happen to mention, for example, one of your admin reception teams is doing a really effective piece of work for them, that as a morale boost for that individual can be really significant. Looking on the flip side, if it's a complaint and stuff, actually knowing the content and the context of that can help you adjust. Actually, was this a genuine problem? Was this a perspective problem? Or is this a system problem that actually needs addressing and stuff? Because you've got that qualitative information that can help you understand that more depth and context and stuff. I mean, that's how I think about it. What about you, Andy?
Yeah, so I would think about that in the same way, actually. And actually, going through medical school, and until quite recently in my career, actually, I always thought quantitative is better.
Mhm.
Collecting these patient narratives. What's the point? About how a patient feels about the service. Give me the data. But my mind's been changed over the last few years, actually, and I think that
Mhm.
qualitative patient feedback can be really helpful because often it's quite specific, about specific problems, things that you just wouldn't get from the raw data. You can learn about
Yeah.
specific problems with processes within the practice, and how things aren't working. And as you say, also, if someone is named in a positive piece of feedback, even if it's you, that feels great. That feels fantastic. So it's
Mm,
very motivational for staff. And similarly, if someone's named in a negative sense, and then we'll probably talk about this a little bit later, but you got to be careful as the person who owns the feedback process, how you pass the feedback to
so,
individuals. There is some responsibility there, and I think we will talk about that a little bit later. The other way I distinguish between different types of feedback is I often think about formal and informal feedback, and again, this is where I've probably learned in the last few years. Really, the formal feedback, that's your friends and family feedback. Those are your metrics, your data.
mm,
But actually, often in the practice, in one of our management meetings, our deputy manager will say, I I get the feeling that the patients are currently unhappy about this. And actually she is assimilating within her mind all sorts of data points about what she's hearing from other staff, what she's hearing from patients, what the mood is. That's quite informal and it's quite soft. But often that can be a really early warning sign before things go wrong later, or we actually see things come through in the data later on, and that she was right about things. So I was thinking it's just, while we're having a discussion about feedback, just thinking about that informal and kind of soft feedback that you can listen to as individuals and as organizations.
mm.
Yeah, do you have a someone within the practice who's really good at sensing that soft feedback, Gandhi, like we have?
I think you'll always have those index people. So for us, as Emily's our practice manager, she's often got a better idea of the pulse of the kind of way that our patients are feeling, way our staff are feeling, all that kind of stuff and things. And like you say, they take in various different data sets to help them understand that. But actually having the evidence is also useful. So that's where the formal feedback can be measured, compared, and because it's more structured, it's reproducible, and that's why it can be quite useful. So they both have their values, but important to remember that informal feedback, just because it is informal, doesn't mean it doesn't have value in that process.
Absolutely. So, and I guess the next sort of lens or thing we were thinking about or framework was we are just thinking about, why do we obtain and use feedback at all in
Mm-hmm.
general practice? And we thought about a list, hadn't we? And we can start to work through it and talk about it. So, um, I guess at the heart of it, it's about trying to improve quality and it's about trying to improve performance. I guess that's why
Mm-hmm.
we do a lot of things in practice, and that's why we're interested in feedback. Um, uh, Other things, less obvious, we've already talked about actually motivating performance towards goals. And that can be that qualitative feedback and comments that people have to just motivate them generally in their performance at work and reinforce positive behaviors. Uh, Dr. Gandhi, listened to my problems,
Mm-hmm.
and understood and spent time with me. That means Dr. Gandhi is more likely to express those behaviors in the future if he's got some positive feedback about it, for
Mm-hmm.
example. So you can, motivate poor performance, sorry, motivate good performance and
Mm-hmm.
improve it. The other aspect of that is sometimes setting, goals and targets as a practice and using, the numbers to say, well, we've set this goal and actually we are ahead of target, behind target. This is where we are in relation to the target. This is where we are in our orientation relative to the goals we have set. It can help you steer towards performance or improvement goals as an organization. I might actually let's show. Should we just show the practice objectives that we have on screen, Gandhi? There we
Yeah,
go.
go
It
for it.
might be a bit small, and I'm not quite sure how to zoom in this view. So people maybe can just lean in closer to their screen. But every year at my practice, we set, and these are open to the patients, open to staff. We set some goals about what we want to achieve over the next year, and then we revisit this every month or two with the whole practice staff to try and steer us towards the goals. And so we are constantly collecting feedback in the form of data, driving us towards these targets. And we set a few areas, and it's probably more for a different session to talk about what they are, but we set some in the areas of growth, around
Sure.
patient experience, around improving access, preventing illness, quality, and supporting staff. We always set some goals around that as well. So just saying, feedback can be an important part of knowing what objectives to set, knowing what your problems are, and then setting objectives that you know you can measure your performance to and plot your course to a goal or an objective as an organization or as an individual. I'll take that down and we can both pop back on screen, I guess, Gandhi.
Mhm.
So that's like, yeah, do you do anything similar in practice, Gandhi? Or you probably do, but
So not in that level, and definitely not along the lines of the KPIs that I know that you've been using in that sense. I think we go more for the qualitative stuff in our practice to understand the impact that's having on patients. But actually, I can see how quantitative like that, being able to share the information, the metrics, and that kind of stuff, and having those KPIs can be really effective for your practice team. I think from a network perspective, we use metrics like this all the time, don't we? In terms of giving us information, but specifically feedback related metrics less often. Although more recently, practices probably have been doing a little bit more about that. So obviously last year we had the QoF on access. This year we've got the QoF on access. These are things that you can do to try and help with those parts of the QoF that you're going to be completing, as well as obviously it feeds into other stuff like the access and improvement reports and all that kind of thing, which specifically do mention some of the things we talked about, like the GP survey and friends and family tests and stuff, don't they?
absolutely. I think these feedback is becoming more and more relevant, as is data in all its
Mm.
forms. Some other less obvious reasons why you might collect feedback or why people collect feedback can include some other things. So, um, there's an element of relationship building. Feedback is communication between the patients and the practice, or between two parties. And actually that can improve the relationship between those two. Actually, if people can give
Mm.
feedback and they have confidence in the system that it's listened to and acted upon, then actually that can improve the relationship. And I know we've gone through various iterations of our friends and family feedback form. And I don't think we currently ask the patient to identify themselves, but we have in the past. And actually, we've had people who've complained via that route. They've left their email address. We've been able to identify them. We've been able to better address the issues that they've raised because we know who
Mm.
they are, so we can match that up with their clinical record, and we can contact them and let them know the outcome, and we can invite them to the patient participation group. And we've had a few people who've graduated, through friends and family complaints to be members of the group. So very in a very real way, we've created some relationships with those patients. So I think
Mhm.
um, that's quite key. Yeah, a few others to go through, but have you had any examples of relationship building through feedback, Gandhi?
So I guess I've had informal feedback from patients when I've been doing, for example, clinics, triage, that kind of stuff, and often had episodes where they've been really unhappy with the service that they've had, whether it's by with the practice or the wider service. Often, and particularly more recently, it's often the wider service. And actually, one of the episodes I do remember is one patient who was really unhappy with the way that their experience had gone with the reception team. So I reflected back to, well, actually, if you've had a really bad experience, why don't you join our PPG? Why don't you help us change that experience? Because actually, we're trying our best to do what we can, and we're going to get it right and we're going to get it wrong. But actually, having your input into where we're getting it wrong and where we're getting it right as well can be a really valuable experience and may help to improve the overall experience. Now, that's a loaded technique sometimes because often you want people who are going to help contribute and stuff. But actually, this patient, to a degree, was right in what they were saying. They had a bad experience, which was partly justified in terms of some of the stuff that happened. So it was about sourcing of medications, which wasn't their fault. It was a wider system issue combined with some possible improvements we could make in practice. And actually, that helped us to improve that process. But reflecting that she could also help us in other ways and improve the system with the feedback actually meant that they considered joining our PPG and actually did until it kind of went a bit quiet because of COVID. So this was all pre-COVID and stuff. So yeah,
Hopefully, she'll be back after COVID.
yeah.
So yeah, so
Well,
and
ours is being rebooted as we speak, so definitely something
y-
to think about.
same here. So a few of the reasons why people might do feedback, again, less obvious ones, and let's get strategic for a moment here, because sometimes you might want to promote or optimize a certain agenda. So you might want to focus on a certain area
Mhm.
and collect a bit more data and bring some more light to that area. So that's an example of some of those practice objectives that I've got. On the flip side of that, you might actually want to defend a position. So I'm thinking really like, tactically as practices, you might feel that your GP survey data, isn't great. You've listened to it, you've been flexible and responsive, but it's not moving. And maybe you think that the reality is
Mm.
different. So you can collect your own data, really go to town on your friends and family and maybe add some questions that are similar or the same as the GP survey
Mhm.
data questions that you're particularly interested in, and you can get some more timely, higher volume, better quality responses. And then when people ask you about your GP survey data, you can say, well, actually, we've done our own collection data to this methodology, and this is what we've got, and this is how we've responded to this newer information that we've got. So sometimes you can be a bit tactical
Mhm.
about how you do it, and there might be circumstances when practices or business or individuals want to do that. And similarly, just thinking about making big strategic decisions as a practice or as a person in terms of what you want to do with your life. Understanding your skills. You can get feedback on that level. But I guess as a practice, if you're making a decision about where to put staff or move staff from, or where to put and how to use your resources, and as a PCN, of course, having feedback, having information is really important to make sure you get those decisions right, so that you do the right things, you put the resources in the right place. And then once you've
Mhm.
done, continuing to collect data about how you're doing and setting those smart objectives, goals, KPIs can be really, really useful. Obviously, you can overdo these things, so you have to be tactical
Right.
not to collect too much, and not to make it too much work to collect the data. You're better off using data that's automatically thrown off and easily collected by processes. But can you think of any other slightly more obscure reasons why people might collect data, Gandhi? You may not have one.
No, I think it's often having an idea of what you want to capture about, and I think that's probably the thing I ask a lot of people to consider when they come to asking for feedback. What is the actual information you need, and ask those questions. Often people start adding loads of extra stuff into there just by matter of course or routine and that kind of stuff, or they're not actually asking the questions that give us the impact of what they're trying to understand and stuff. So it's what is the information you absolutely have to have, and ask those questions, and specifically the questions that give you the answer to help you understand that problem. Does that make sense?
Mm. Yeah, it does. I mean, like targeted, right? You're saying, be
Yeah.
targeted. So like we have to expend energy asking for it. People have to expend energy providing it.
Hmm.
We have to process it. So let's not ask for feedback that's not going to be helpful, and make sure that
Hmm.
it is going to be helpful what we get. Yeah, I totally get that, Gandhi.
Hmm.
So think about just think about really what types of feedback we encounter or we use in general practice, or what can be useful for us. Um, and I suppose the one that is historically the most well known is the GP patient survey. We will
Yeah.
probably link to our latest video that we did on that. It's released every summer. The data practice have a contractual obligation to reflect on the data, and it can be useful. I mean, we talk about it in the episode that it's provided once a year, and often the numbers of responses are low. Often rely quite a lot on
Yeah.
paper responses. Although we did have some uh, feedback on that episode from the people that produced the survey and some people involved, and they said they're actually moving towards something that is more timely and contemporaneous, and that uses
Mhm.
lots of different modalities in terms of getting information from patients. But yeah, what's your feelings on the patient survey these days, Gandhi?
I mean, it's a massive survey, so there's that element of there's potentially there's barriers to understanding how many people complete it and stuff. Like you say, it's targeted as well. So, well, not targeted. They send it to particular portions of your practice list size. They don't send it to every patient, which I think is interesting because obviously, if you really wanted decent feedback, you should ideally be sending it to the whole population. But understandable, but the cost and appointments of aspects of that can be more challenging and stuff. I often don't like the questions on the GP survey. I don't think they ask the right questions. I think they ask about things that are just too broad, and therefore the interpretation of them is so broad that it doesn't give you the relevant information to help you understand it from a practice perspective. So, they will ask about having an appointment in your practice with your GP. Well, actually, we've moved towards where skill mix is a huge portion of that. So actually, access is not around just seeing a GP; it's around seeing your practice team, and was that the most appropriate way to do it. So focusing on the language and the way that they ask those questions, I think, is something that has to change, particularly given general practice has changed, but the survey hasn't. That's my personal view,
Yeah.
because it talks about appointments again. Is that we've seen a drop in many of the response in terms of the quality of the responses for many practices in terms of them having a more negative output since COVID. But what patients often don't recognise is that they have had an appointment. It's been a telephone call, it's been an online consultation, but in many patients' head, an appointment means seeing a clinician face to face, and that's not captured in the survey because that's not the questions they're asking, and that's what really frustrates me sometimes.
Yeah, absolutely. And they try and keep the question the same year on year because they allow you to see how the responses to questions have changed. But actually, general practice changes often a lot more quickly than that. So
Yeah, light speeds quicker.
I understand why they're doing it that way. I mean, I guess in defense of the survey, a lot of resources spent collecting this data. Every single
True.
practice in the country,
Yep.
has patients approached, and they use the same methodology and they ask the same questions to everybody. So actually, in terms of comparing, practice to practice, area to area, there's some strength in that methodology. We're often left as a practice after we review that information saying, okay, we've seen this trend, but we want more information so that we can actually change something. And that's just that's not there. If I had if I could ask them to do something, I'd say, I'd love you to collect a bit of free text, and then let us see it
Yeah.
so that we can at least understand the context of why people are answering in this way to this question. But we will do another episode on the GP patient survey later in the year, and
Yeah.
pick that apart a little bit more. I mean, the other big thing people do is the friends and family question. So that's an example of something that is conducted by patients themselves. And at the end, we're going to answer Victoria's question, not too much longer to wait. And I will talk about how we do that at my practice. And Gandhi will probably share his practice. So we're not going to talk about the specifics of how we do that now. But Gandhi, in terms of collecting survey responses yourself in practice, I know you had a few things to say about how to make that easier, and we've probably both got a few things to say about the specific, about tools that are useful for that. So, what were your thoughts on
I think it's basically
doing
making
it?
it more. Yeah, I think it's about making it more accessible, isn't it, Andy? So you need to have those things at the point the patients are having contact with your practice. If they're coming to your desk, you need to have a stack of friends and family test forms potentially that they can fill in that are really easy to do now. Does that have to be paper? Could that be a tablet? Could be either, to be honest. What about a QR code on the desk? So patients can scan it, or a short link that makes it really easy for them to type it into their phone, tablet, browser, whatever, that kind of stuff. Let's go a step further. What if you send them messages after their appointments, which I know is one of the routes that potentially you've used and stuff to capture that information about how you can get that live, live patient feedback in terms of what you're trying to do and stuff. So it's about trying to make it as accessible as possible. So once you do that, you are likely to get better pickup rates. You could even go down the route of doing some sort of carrot potentially for how they give the feedback. You're not meant to do that for the friends and family test, but other routes, do you have a competition? Do you have, a reward, that kind of stuff if you're doing more specific or targeted, surveys or feedback episodes and that kind of stuff. And that can be really useful. And then my last tip is about semantics. It's about using the language correctly. So, one of the things I will often do is, if I want patients to give me decent, qualitative feedback, make the short links as easy as possible to use and also direct them in terms of what you want them to do. So actually, if I want you to rate the practice, the short link will say rate the practice, because actually that's the information we want. And that helps give the context of what you need to do.
Yeah, fantastic. And I guess just in terms of what you're using to collect the data, I mean, I'll talk about how we use a plugin on our website when I get there, and I'll probably talk a bit about alternatives. But with NHS Office 365, we've all got Microsoft Forms now.
Yeah.
So check out Microsoft Forms. You can quickly and easily, it's as easy as doing a Word document or a PowerPoint presentation, create a feedback questionnaire, and then MS Forms will generate a QR code for you. It will generate a short link, and it will do some presentation and analysis of the results. And you can download the results as an Excel file if you want to do something a little bit more clever with pivot tables or whatever with the results. So that's a hot tip these days for me is MS Forms. But there's other things out there. But particularly the NHS has purchased that for use by NHS staff. So I think there's something in the governance there. Go on,
I
Gandhi.
think important to note from a governance perspective, if you're doing patient identifiable feedback, so if you're asking for example, email addresses, demographic data, that kind of stuff, then you should be using MS Forms. If you're not, so if it's just literally qualitative or quantitative data that doesn't have any bearing on patient identifiable information, yes, you can absolutely use other platforms, things like Google Forms, could use SurveyMonkey, that kind of stuff, and other platforms and things. But actually, Google Forms, Microsoft Forms, they're free. They're pretty much to give you all the information you need and enough, and they're backed up by things like Excel and Sheets, so you'll have the analytical stuff afterwards to help you understand the data as well. So both of those are sensible for me, but absolutely from a governance perspective, Microsoft Forms is the better one to use if you're doing patient identifiable information there.
Yeah, absolutely. And yeah, and thank you, NHS Digital, rest in peace, for bringing the Microsoft suite to the NHS. So other forms of feedback. So that's sort of patient feedback, but there is feedback from basically there's a lot of performance data, performance
Yeah,
dashboards out there. Almost too many, maybe, but
yeah,
they can be really useful to help change performance. So I'm just thinking, let's think locally. So we have a system called eHealthScope, which is basically the local sort of health informatics data system. There will be different versions of this or different examples of software in other areas, but that takes system data, so from the hospital, A&E, GP practice, and allows that to be presented and interrogated in all sorts of ways, comparing practice to practice, PCN to PCN, on all sorts of different measures of disease management, from how
mm,
well are you managing diabetics HbA1cs to how often people are attending the emergency department. And you can actually drill down and go, right through the data, right down to the individual patients that produce that data, so that you can go in and try and action or influence or change the health of that individual patient. Really, really powerful. I know as a practice in the PCN, we bring those up in meetings, to help have discussions around where performance is different, where performance could be improved relative to guidelines and targets, and to help us think about how to improve and then track how that's improving. So I would
mm.
put that in the feedback category as well, because it's part of that loop. I imagine you have similar practices in your primary care network, Andy.
Yeah, so like you mentioned, the health scope, there's other kind of, particularly system one is looking at things like visualization, so it'll give you
Yeah.
more data that you can share as well. So I know we covered that in the GP learning stream about visualizations. That'll probably be coming up our upcoming conference as well, that is hopefully in the works. So definitely watch out for that. But like I said, there is a variety of local and national data within the systems that we have that you can use to give you some of that feedback method, and some of the tools that you can use as well to help gain that feedback in addition. So the system one questionnaire function is actually a really powerful one to get feedback for obviously things like QoF and IAF and stuff, but you could potentially use that for patient feedback as well in terms of the services and things.
Yeah, absolutely. The next one on the list, we'd put GPAD on the list, and I think we've talked about general practice appointment data a lot elsewhere. I guess this is on the list to say that it's there, and also probably just to highlight, there's always quality issues with feedback
Yeah.
and and data, and just to understand the processes that drive that data, and whether or not it's good enough, to listen to, or whether or not the process can be improved. I'm
Mhm.
going to let you speak for less than 60 seconds about GPAD, Gandhi, no more, if that's all right.
Fair enough. Yeah, because Andy knows if you get me started on GPAD, I sometimes don't stop. But simply put, we know that GPAD, from a perspective, the data is flawed, but it is data that you could potentially use. It's how you collect it. And many practices are going to have to focus on this with the access stuff that's coming through in terms of the improvement plan and things. And actually, there's a section on there to do that. But the key thing is make sure the data is as accurate as possible, but more importantly, it's shared properly as well. So actually, from a practice perspective, use your GPAD data to share with patients about what you're already doing, because a lot of patients don't realize how much workload we are doing in general practice. So look at your GPAD data, really go to grips with it, and share the parts that are absolutely relevant for your patients to know about how much amazing work general practice is actually doing.
Yeah,
I'm going to stop there
absolutely.
before I go into it.
Yeah, and actually engaging with the GPAD data, I think, is driving improvement, in the data, because I know practices are looking at how to improve their, their GPAD data by being better about
Mhm.
the data collection. So maybe it will become useful in the future. Gary, we popped cloud-based telephony on there, because that might be a future source of, data to put into our feedback
Mhm.
loops. What was it you wanted to say about cloud telephony?
So cloud-based telephony can provide you with additional metrics and information. It can give you information about your call volume. It can give you information about your dropped calls, your unmet demand, in terms of actually some of the outcomes you have done. So how long do patients have to wait? Has that changed over time? And actually, as a result of that, that's something that patients won't immediately be able to recognize. But if you've managed to change your waiting time for your calls from, say, for example, 15 minutes down to 10 minutes, that's a 50% improvement in productivity, but also that's a 50% improvement in experience for those patients. Now, they may not see that, they may not feel that, but that is still an improvement that has happened. Or if it's got worse, why has it got worse? Are there other factors you haven't considered that can help you feed into the feedback that you've now got to help you change what you're doing in practice? So cloud-based telephony is additional data points and useful data points. It is mandatory. It's now part of the contract, and we covered that in one of our earlier episodes about the GP contract changes and stuff. But utilizing that information and even the dashboard data it can give you, that again you can share with your patient population to help them understand the workload that you're currently doing.
Yeah, I mean, we have a computer in reception the inside of reception, the admin area, that shows the call waiting time and the number of callers waiting, to our receptionists as they are answering. So real time data feedback, to affect their their motivation and their performance. Interesting, Andy. I hadn't thought about it until now, but what would happen if we put that on an external facing screen, showing the waiting room, or live on the website? I don't know, but it's an interesting thing to think about, isn't it?
But if you
And it
think
would be
about it, Andy, it's no different to what they do in certain, for example, A&E departments. They tell you how long the waiting time is in A&E. Yeah. Actually, why don't we do that in general practice? Why don't we put that on our practice websites that shows how busy we actually are in terms of, and then patients understand. And one of the things that may help with is that 8 a.m. rush, because actually patients understand that generally speaking, the waiting time in the morning is huge. Actually, later on in the day, if you don't need to see us that morning, if it's more about admin stuff, calling later on in the afternoon when the waiting time is much smaller often is a better experience for everybody.
Yeah, and yeah, being able to see that might change the patient behavior, so they don't call when it's really busy. If it's not that important, they can choose, they can prioritize their day, in terms of when, how important it is them to stay on the phone and how long they want to stay for that particular problem. Yeah, really good thoughts there. The other, so something else that we thought about was actually don't forget your staff. So there's the, employee feedback. There's the, there's the annual NHS staff survey, which we do every year, and we have a look at the feedback. Often looking at, are people planning on changing their job? That's the one that we look in. Which category are they in? And trying to triangulate who they are sometimes. Although it is supposed to be anonymous. So, but remember your staff. I guess we could do a separate, session, on the NHS staff survey, to be quite honest. But just don't forget them. And in appraisal, we do 360-degree, peer feedback as well as patient feedback, which just led me on to thinking about, as people who, I guess we're partners, we will own and control some of those feedback structures that are in place. So with that comes some responsibility to use that feedback carefully, I guess, with regards to staff. We might be in possession of some negative feedback about staff that needs to be delivered in a sensitive way, and not via some mechanism that automatically posts all the feedback somewhere public, or or even if we're tackling it, we need to tackle that in a personable and supportive way that will produce positive change. You get any brief tips about that, Gandhi? I know you're a GP trainer, and so you probably looked at the best ways to give feedback. Again, potentially potentially a session in itself. But any thoughts?
I think there's always the questions of how do you ask the data first of all, and what do those bring forward. So, for example, all of the ones that I look at for my GP trainees, ask them about their clinical ability, their administrative ability, but it's fairly brief, to be honest. And a lot of the commentary, which is actually the most valuable thing, because the numbers to a degree almost mean very little. It's the commentary you get, and then picking apart what can be really subtle commentary, because the sample numbers are normally quite small. You're talking about 10 responses. So how does that bear in mind, and is that reflective of the experience? So it's often saying, okay, so someone's made this comment. Why do you think they've made that comment? Is there anything that you think you can reflect on that supports or detracts from that particular comment? And if it's a positive one, is that your experience? Were you aware of that being a really positive feature about yourself? If it's a negative one, actually, why do you think they felt strong enough to write that on a feedback form? Because that's the key thing. Your colleagues generally don't want to give bad feedback about you. So if they're having to give bad feedback, is that something actually we really need to consider looking at?
Absolutely. So it's providing that context, I guess, for that
Yeah.
individual, and then helping them cope and through the response. Which if it really challenges that patient's opinion, that person's opinion of themselves, that could be quite painful,
Yeah.
process for.
Sure.
So good. So Victoria has been waiting for 40 minutes for us to get to the point where we specifically answer her question. So so I guess I'll go first. I think she may have heard us talk in the episode she watched about the mention we made of our use of friends and family feedback at my practice. So I guess I'll just describe what we do really from start to finish. So we've been doing this since about 2017, 2018, a long time. So we've got a lot of back data that's really useful for us now. We really think the friends and family question is a good one. It's good because it's easy to ask, and it's good because it's a lot of other services and GP practices ask the same question as well. So there is some comparative value in that as well, both across different organizations and yourself over time. They're asking the same question. It's important to us that people give us their feedback, as soon as possible after the appointment, before the memory fades. It's important that we get as many people to answer as possible as well, that we don't just leave it so much to patients' motivation to pick up a form, or to, go on the website and do that. We make it as easy as possible, because that way we think that we capture more feedback. And in particular, we get a more realistic and a more truthful assessment of what the situation is in terms of how satisfied people are with our service. I guess what I'm saying is, there's an inclination that, or there's a thought that people who've had a bad experience are more motivated to write a response than people who have had a pretty good but not amazing experience. That those people just walk away and don't provide feedback, but their input and their feedback is valuable, so that you don't place too much emphasis on the on the negative feedback if that's not appropriate. So we want to drive as many people as possible as well. So what we do is every day there's a search that runs on System 1 that identifies everybody that had an appointment the day before. So that's not an admin appointment for someone to do something. If they've had an appointment where they've interacted with someone at the surgery. And then we automatically send all of those people a text message, which is carefully worded to try and motivate them but not obligate them to complete the survey. And in that, there's a hyperlink that they can click. Everyone has most people have a smartphone these days, and actually they can click the link. It opens up their browser. It makes it very easy for them to move into a web-based survey environment. So that's really good. We have paper forms available at reception. We have feedback cards that we've had printed to give to patients, so we're not forgetting our accessibility obligations as well. Can you just bring the screen up again, Gandhi? We're on our website here. So the feedback, it takes them directly to the give feedback button, which is always in the top left hand corner of our website. And we've changed what the question is over time. Currently it asks this question. So this is powered by a plugin at the back end of our website, so WordPress plugin. I would say don't get too hung up on that. Just use MS Forms. And I think if we were designing this today, we would probably use a link to MS Forms. I guess that takes you away to somewhere that's outside of the website, and there's something for it being embedded in our website so people know that it's definitely connected to the practice. But I think we would still use MS Forms if we were doing it today. Ask questions for some structured data collection about who did they see, was the experience good or not, tell us why you gave this answer, tell us what you can do better, and would you like to be contacted about it. And I think we then ask for some contact details, and we've made sure that we're happy with where the server is geographically, and that we're happy with being in possession of that information. And then in the back end on the website, the plugin produces reports, graphs, things that you can just show like that in a meeting. You don't have to do something clever with a spreadsheet or a PowerPoint. We just bring it up live within meetings, look at the feedback, raw. We get about 30 to 40 responses. We've got about 10,000 patients. We get about 30 to 40 responses per month. So actually quite a high volume, of feedback, to be honest, compared to what many practices get. And we find it really useful. How do we use it? Well, where we know what's happened and we know who the person is, we can actually investigate, concerns, or where things have gone really well. effectively, and we can actually learn more effectively from it in terms of looking at the individual particular issues. We do sometimes build those relationships with patients and get back and have a chat about things, or even get them on board with the PPG. The other thing which we have done from time to time is we say now rate when they complete it. It says now rate us on NHS choices, and this was a bit of a controversial idea
Mhm.
when we first did it a few years ago. It's like, oh, do we really want more reviews? Maybe they'll be bad. But actually, I think there was a net increase in our star rating on NHS choices, because it got those people to it got some people who had maybe not yes, fantastic experience raters 5 stars, but some of those people who had like, yeah, I had a pretty decent experience. I wasn't necessarily going to rate you on NHS choices, but you've sent me a text message, you've made it easy, you've linked out specifically on my phone at
Yep.
the end of the survey to NHS choices. Yeah, I'll give you a star rating. So we actually got more ratings that were all right, and that improved our ratings. So that's something I encourage
Mhm.
practices to do. I've got a video to play towards the end, Gandhi. But how do you handle friends and family in particular at your practice, or do you have any sort of tips based on what I've talked about?
So I think Andy's covered loads of stuff from a practice-based perspective. It's all right, and I'm going to talk about it from a slightly different perspective, and that's the PCN one. So obviously with
Great.
capacity improvement plans and stuff that people have mentioned and stuff. So often you are then looking at more detailed kind of questionnaires that you're looking at, because you're wanting to capture more information. And I think a couple of things just to be mindful of. If you are using MS Forms, some settings on MS Forms require you to still have a Microsoft account, and that can sometimes be some interesting information about your population. So we found this out when we did the Access quaff from last year, that actually, because the settings weren't unfortunately correct at the time, if you didn't have a Microsoft account, you couldn't fill in the form. You had to sign up for a Microsoft account, which was really telling of the fact that generally Microsoft accounts are used by business people or employed people, and those that aren't employed may not have a Microsoft account, so therefore couldn't you fill in the forms. So it's being cognizant of some of the impacts that may have in people being able to fill in, because we had patients contact saying, I can't fill in the form because I have to get a Microsoft account first.
You could turn that off, right? I think, but you
Yeah,
just have to
so you
be
can turn it
aware
off,
that you
but
can do that.
it's a really
Yeah.
tiny setting that you have to look for. So it's one of those things you won't immediately be aware of if you're using that route. It was fixable, it was manageable, there you go, and stuff. But yeah, no, important to be aware of that kind of those kind of issues and stuff.
Yeah,
I think the other thing,
test it out, I guess. I would just say, just to
but,
test your system to make sure it works, or get some
yeah,
friendly patients to test it.
so this was going to be my next point. Whatever form of feedback you're asking, always test it first. Actually test the form, but also test the questions. Like I mentioned earlier, ask the questions that give you the answers to the information you need to know about, not just the questions you think are going to be right, because otherwise you end up finding that you're not actually answering the problem that you need to answer. So, you have to have a dry run through, and I would really recommend you do that beforehand. I know sometimes there's that push to get it done, let's get through it and stuff, but go through the questionnaire. Does it look right? Does it flow right? Is it too long? Another tip is very much often from NHS perspectives, they want things like the demographic information, the equality and inclusion information, all that kind of stuff, which is important to collect sometimes. Put that at the end. Don't make that the first thing that the patient's having to do, because it will make your drop off considerably higher. Whereas if they've invested a little bit of time in terms of doing some of those more detailed questionnaires, once they've done some of it, they're more likely to complete the rest of it. But even better still, if you don't need that information, finish the questionnaire and put a link to the second one afterwards. It gives the patient a choice. Do they want to fill in additional information? And if you're particularly sectioning off the kind of information you're trying to get, that can work a lot more effectively in terms of capturing more information and relevant information. So you could always have that pre-questionnaire of quick, simple, essential questions. Once they finish that, thank you for giving us that really useful information. If you would like to give more commentary, please fill in this questionnaire, which will take you about 3 minutes. That's the other thing. Any questionnaire always indicate how long it's actually going to take them to do the form. Really important.
Absolutely. And that's where a lot of the tools help you out, because a lot of the tools will say that as well at the top, or they'll attempt to.
Yeah.
But you can put that in your free text as well. So that's good. Apologies, I think everybody just learned that I have a rather elaborate doorbell, which might ring again in a
Fair enough.
second. Um, so yeah, so
I guess
I
that
think one of
sometimes
the
there's times you want to get information in the practice, isn't there, Andy? So I know you came up with a really cool mechanism of doing this, and I think we should need to show this to people. At the very least, it gives us a bit of a time warp, doesn't it, Andy?
So let's go down memory lane. So it's really this video is actually really good, and it's only about 2 minutes long. And I suggest, Candy, that we watch it and we can react a little bit to it. Actually, this broke, unfortunately, this stand. But when we started doing the friends and family tests, we thought really hard actually about accessibility. We thought, what about people in the practice? Would it be nice to collect their views in a way that's easier than asking them to to do it on a piece of paper, do something a little bit flashy that maybe drew some attention in. So we had a little banner, and we had this device, which is a tablet on, I think it's called kiosk mode. So you can, these days you can do these things with the tablets obviously as well. Android and Apple have modes where you can set it so that they can't get in the back end, they can't access the settings or any other application apart from the browser that it's set up at, and even they can only access specific web pages. You can really lock it down. So we put this in reception for a while, and it connected to Wi-Fi, and it fed into our friends and family feedback. But let's watch and just have a fun for 2 minutes, Gandhi, and respond.
Okay, hello, thanks for tuning in. This is a video from Parkside Medical Practice in Bulwell. I'm Dr. Foster, one of the GPs.
Interesting moustache.
So today we wanted to introduce you to a new piece of equipment that's appeared in the surgery. It's our feedback station. So this is normally positioned in the main corridor as you go to and from your appointments. It's something that we've put in place in collaboration with our patient participation group. So feedback station, why is feedback important to us? Well, we've got quite limited resources at the practice, as with most GP practices, so it's really important that we know what's important to our patients and what you want us to focus on. It's important that we know perhaps when we could have done things better, or when you feel that we need to improve in certain areas, so it's important to let us know that. It's also important to let us know where we're perhaps doing things well, or we're doing things that you like us doing, so that we know to carry on doing those and continue to put effort in those directions as well. So there's a number of things that you can do on the feedback station. You can give feedback, of course, which we're talking about today. You can also sign up for practice update emails to learn more about the practice and receive news when we have new members of staff or services become available. That'll also sign you up to the electronic patient participation group. So you'll get agendas of emails about our patient participation group. And you can access some really good self-care and self-referral information. Some of that's provided by signpostinghealth.com, which is provided by our local federation, NCGPA. So let's have a look at the feedback functions. So you would come, press feedback. There we go. And very simple. So you can answer our friends and family test question. Would you recommend our service to friends or family moving to the area? Select your answer from extremely likely to extremely unlikely. Really useful when people give us a textual comment. Those are the things that we share with staff, and those really enable us to focus our attention on things that we're doing well or things that we can improve. So enter some details and then click the submit button, and that'll wing its way to us, and we will review that. You can also leave a comment on NHS Choices for us here by clicking on the NHS Choices icon there, and we really value that feedback too. So thanks very much for listening to the video. The next time you have an appointment at the surgery, please, on your way out, come to the feedback station, use it and tell us what you think about the services. Thanks very much.
Awesome. So that was fun, wasn't it? It broke and we stopped using it, but having dug that out of the EGP Learning archives, I'm quite inclined to bring it back actually, because it looked like a good piece of kit. But there we go.
And there's something about placement as well, isn't there, Andy? I mean, you would immediately be thinking, stick this right at the front of your waiting room, yeah? Actually, if it was me, I'd probably put this just behind the door of where patients go, towards going to where the clinicians are, mainly because it captures the information of the patients who have likely had an appointment, yeah? But also it try and reduces the chances of, for example, in the waiting area, kids having play with it and stuff and accidentally knocking it, breaking it, that kind of stuff. So it just changes the way that you do it, but have it on the way that as patients are leaving or coming into the actual contact area, that may help to give you more perspective, maybe.
Yeah, it'd be fun to have to do that again, and maybe do a little tutorial around how we did it. But so there's always all sorts of fun ideas I think that people can have with feedback and friends and family test, how to collect it, how to use it, provided, as we said at the beginning, people's mindset around feedback is in the right place in terms of how to ask for, receive, and use it. It's been really fun doing a EGP learners question and trying to help an EGP learner out there, and we would love to do that again. So if people could email, contact us on Twitter, Gandhi might remember the speak pipe details in a second, and let us know what your question is, and we'll try and pick that apart for you and help you and do another clinic on another topic. How's that sound, Gandhi?
Sounds great. If you want to contact us through SpeakPipe, it's speakpipe.com/EGP learning. That allows you to send us a recorded audio version, or as Andy mentioned, you can email us. Twitter is a great place for both me and Andy directly, or ultimately, if you're watching this video on YouTube, stick a comment down below. I generally check most of the comments still and respond to them as quickly as I can. So we are more than happy to understand your challenges in general practice and help you try and tackle them. I know we cover loads of stuff like contract changes, tech tools, all that kind of stuff, but actually we also like to help solve your problems. And this is definitely a problem that many practices are going to face and stuff. So hopefully that's helped to answer those particular questions. Alternatively, if you do want to check out more content, that video that Andy just showed, we'll put the link to that right here, as well as some other information that we've done on feedback, which is coming up right here. And as always, we're here to help tech enhance your primary care and learning. And we'll catch you in the next episode. See you later.